Chapter 28, Reproductive System, Screencast 3. This is the last screencast that will actually be addressing the female reproductive system. First thing that we'll be looking at is the external genitalia, and this consists of the vulva. The vulva is made up of the mons pubis. This is skin and subcutaneous connective tissue that is anterior to the pubic symphysis, and in post-pubescent females, it is covered in pubic hair. The labia majora, this is paired thickened folds of skin and connective tissue. It is actually homologous to the scrotum in males. It is covered with pubic hair in adulthood, and there also are numerous sweat and sebaceous glands. The labia minora, these are paired folds that are immediately internal to the labia majora, highly vascular layer of areolar connective tissue, and this area is actually devoid of hair, numerous sebaceous glands, and the melanocytes. The vestibule, this is the space between the labia minora and the urethral opening and the vaginal orifice. The bulb of the vestibule, this is an erectile body on either side of the vaginal orifice, and this actually increases in sensitivity and blood flow during sexual activity. There are greater vestibular glands. These are housed in the posterior lateral walls of the vestibule. They actually secrete mucin and mucus lubricant. The clitoris, this is a small erectile body in the anterior region of the labia minora. There are many specialized sensory nerve receptors here, and they are primarily for pleasure, and it is subdivided into the body, crus, and the glands. The parts of the clitoris, there are two erectile bodies, the corpora cavernosa. They actually form the body, and they will engorge with blood and increase in sensitivity during intercourse. The pubis, this is an external fold of the labia minora and actually is the clitoral hood. Now, the last structures we will address are the mammary glands, each located within anterior thoracic wall, and they are composed of tubuloalveolar exocrine glands, and they are producing breast milk. And the contents of breast milk are proteins, fats, lactose sugar for the nutrition of infants. The nipple, cylindrical projection in the center of the breast, multiple tiny openings of the excretory ducts, and they are responsible for the transport of breast milk. The areola, that is actually the pigmented ring around the nipple, and there is an uneven surface due to the sebaceous glands and the areolar glands. Here we basically see the anatomy of the mammary glands. Now, lactation, this is the process in which breast milk is actually released. It will occur in response to both internal and external stimuli, and the mammary glands will start to produce milk after giving birth. Prolactin, this is a hormone that's produced within the anteropituitary, and it is the hormone that is responsible for milk production. With increase, mammary glands formed more and larger alveoli. With the oxytocin, this is produced by the hypothalamus and released from the posterior pituitary. This is responsible for the ejection of milk. Previously, this was used as an example of permissive hormone release, in which hormones have to be released in the exact order for things to work correctly. So it makes sense here. We're looking prolactin. You need to have milk first before it can actually be ejected by oxytocin. Now, the next few slides are looking at various forms of contraception, and the only type of contraception that is 100% going to prevent pregnancy is abstinence. There is the rhythm method, and this basically is avoiding sex during ovulation. There is a failure rate of approximately 25% associated with the rhythm method. There is the withdrawal method. This actually is pulling out prior to ejaculation. This has a failure rate of approximately 19%, and there are numerous barrier methods, and they actually prevent sperm from reaching the uterine tubes. Examples would be condoms, spermicidal gels, and diaphragms. Also, lactation, because during lactation, there are signals to the hypothalamus to prevent follicle-stimulating hormone and luteinizing hormone release, and this actually will temporarily prevent ovulation from taking place. There are intrauterine devices. These are flexible plastic structures that are inserted into the uterus. They can be made of copper or synthetic progesterone to help prevent implantation. Oral contraception, which are probably the most common, these tend to be synthetic estrogens and progestins, and they actually prevent a spike in luteinizing hormone and ovulation. There are injected progestins. These actually prevent ovulation and result in a thickened mucus around the cervix. There also is the morning after pill. This actually inhibits ovulation, and this needs to be taken within 72 hours of unprotected intercourse. Mifepristone. This is something if it's used during the first 7 weeks of pregnancy. This actually induces a miscarriage, and this is actually has been called as far as the abortion pill. And what it does, it basically blocks progesterone receptors. There is tubal ligation. This is surgically cutting uterine tubes and tying off the ends, preventing sperm from reaching the uterus. And there is the vasectomy. This is an outpatient procedure. The ductus deferens are cut, segments removed, ends tied, and because of this, sperm are actually unable to leave the testis. Excuse me. The last clinical view that we'll be addressing is breast cancer. Breast cancer occurs in 1 in 8 women in the United States. If we look at the risk factors, they include family history, a longer reproductive span, obesity, nulliparity. This is late age at first pregnancy, and specific genes. Specifically, you may have heard of BRCA1 and BRCA2. And once again, this type of cancer is most related to increased estrogen exposure, and it arises from the epithelium duct. And mammography is used to detect small malignancies early on and should be done every 1 to 2 years in women after the age of 40. The last slide that we are looking at is describing the female sexual response. The first phase is the excitement phase. This is the period of time when the reproductive organs are engorging with blood. Examples would be the clitoris, the bulbs of the vestibule, and the labia. Nipples become erect. The uterus actually shifts. It becomes more erect. The vestibular glands and walls of the vagina produce a mucus. There is a slight constriction of the vaginal wall, and also a period in which heart rate, blood pressure, and respiratory rate are increased. Then there is orgasm, that is intense pleasure, release of tension, and also rhythmic contraction of the vagina and uterus, which occurs for several seconds. There is the resolution phase. This is when the uterus returns to its original position. There's relaxation of the vaginal wall. Excess blood begins leaving the tissues. And one thing to keep in mind here is women do not experience a refractory period, so they are capable of having multiple orgasms.